Welcome to the dementia-friendly training module for transportation providers. This training is presented by Age Guide Northeastern Illinois. The objectives for this training module are to 1. Review dementia. 2. Identify challenges for people with dementia when using various modes of transportation. 3. Discuss dementia-friendly approaches. 4. Discuss dementia-friendly strategies for transportation drivers. And 5, list some important considerations for communities. To start, we are going to go over some background information on dementia. You've already seen this in the previous training module, so this will be a quick review. Remember that dementia is the general umbrella term for disorders that cause chronic impairment of the brain's mental process. It often affects the individual's memory, thinking, decision-making, and ability to perform everyday activities. There are many different types of dementia. The 4 most common types in order from most common to least are Alzheimer's disease, vascular dementia, dementia with Lewy bodies, and frontotemporal dementia. In addition, there is a type of dementia called mixed dementia, which occurs when an individual has more than just one type of dementia. Again, you've already seen this in a previous module, so this is just another quick review. Symptoms and signs of dementia can often differ depending on the specific type of dementia. However, some common signs and symptoms include communication difficulties, wandering, losing things, frustration, repetition, poor judgment, unacceptable behavior, and confusion. Despite these symptoms, persons with dementia are still a valuable contribution to their community, and they are still a person. The disease does not diminish that. Next, we will review some challenges that people with dementia may encounter when accessing transportation services. These common challenges are essentially clues that riders may need some extra help. For instance, riders with dementia may have trouble remembering appointments. They may have forgotten their scheduled ride or where they are going to. In addition, riders may express frustration towards others in the vehicle, such as the driver or other passengers. People with dementia may also experience agitation or anxiety. Due to their cognitive problems, riders with dementia may be confused about important details, including time, people, and places. They may also have difficulty following directions. They may not understand certain simple commands like, please close the door, or please wear your seatbelt. As the training mentioned before, repetition is a very common symptom of dementia. With that said, a person with dementia may ask the same question over and over again. Lastly, a common challenge for people with dementia is incontinence. In other words, riders may have a lack of control over their bathroom habits. Like the training module mentioned previously, people living with dementia often have a hard time communicating. So here are some dementia-friendly approaches to communicating that can be easily implemented. Number 1, be respectful. It is crucial to treat people with dementia with dignity. They are still a person. Therefore, you should always talk directly to them individually and avoid talking past them like they're not there. Number 2, offer support. If a rider with dementia has trouble communicating, it is important to give them reassurance and comfort. Avoid criticizing, correcting, and fighting them. Instead, encourage them. Number 3, be patient. Let them know that you are listening and trying to understand, and give them enough time to process and respond to you. In addition to the riders, drivers are equally as important within the transportation sector. With that said, here are some dementia-friendly strategies for transportation drivers. First, learn as much information about the rider ahead of time. If you are prepared for their dementia, such as being aware of their needs and cognitive abilities, then you can better support them during their ride. When you first start the ride, let the person with dementia know that you are there to help and answer any of their questions as needed. When communicating, be sure to speak slightly slower than normal and be patient in waiting for their responses. Give concise and simple directions to persons with dementia so they can easily understand. Ensure that you have an emergency contact on file, such as a caregiver, family member, or close friend. Offer to call the emergency contact if and when it is needed. At the end of the ride, be an advocate and share any concerns you have with a loved one if needed. In order to successfully create a dementia-friendly transportation system, there are many different things to consider. And here on this slide is a list of some important considerations to think about. However, this is by no means an exhaustive list. First, consider the many options for transportation. Transportation doesn't technically mean a car. There are many options that include walking, biking, and public transportation. In addition, there are a variety of delivery methods like fixed route, dial-a-ride, volunteer programs, taxis, shared ride options, and many more. Second, it is critical to create a transportation system that has easy access for people with dementia. Consider how people with dementia will request rides, call-in, online forms. Along those same lines, think about the timeline to request rides in advance. Do riders need to request transportation 24 hours ahead of time? 48 hours? Ultimately, the goal is to create a dementia-friendly transportation system that is consistent and reliable. In order to do that, it is important to vet and train all drivers, even volunteer drivers. It is also important that the drivers adhere to the schedule of pickups and drop-offs, because riders may be going to scheduled appointments. As you complete this training module, I encourage you all to view the additional resources in the PDF download on the Age Guide Learning Center or in the description below if you are watching on YouTube. These resources will aid you and your business in your efforts towards the dementia-friendly initiative. Please feel free to download, print, keep, and share the handouts. Thank you for your commitment and conscious effort in caring for people living with dementia in the communities that you serve. Upon completion, a follow-up letter, certificate, and dementia-friendly window cling can be provided to your business. Please share this training far and wide to the other colleagues and other organizations in your network.